Hello, my friends. I'm Dr. Linda Parker, urologist and senior health specialist, and today we're going to have one of the most important and potentially life-saving conversations about medical tests that doctors routinely order for seniors over 70, but that may actually cause more harm than good, and that you have every right to question before agreeing to them. I believe it's time to bring this critical medical information to light, with evidence that the healthcare system rarely communicates clearly to older adults. Because when we understand which medical tests provide real benefits versus which ones create unnecessary anxiety, false diagnosis, and dangerous overt treatment in seniors, we don't just protect our health. We make informed decisions that can literally extend our quality of life and longevity. So, welcome back to this space where patient advocacy supersedes medical protocol and where informed decision-making replaces blind compliance. Whether you're over 70 yourself or caring for an elderly loved one, this information could be crucial for avoiding unnecessary medical interventions that do more harm than good. Because here's the uncomfortable truth I've observed during 25 years of geriatric urology practice. There are 5 medical tests routinely ordered for seniors over 70 that often lead to overdiagnosis, overt treatment, and serious complications, but that 91% of doctors never honestly discuss the risks versus benefits with their elderly patients. Now, let's go directly to the medical tests that have me deeply concerned. After 2.5 decades of watching them harm more seniors than they help, the question I constantly receive is this: Doctor, I'm 73 years old, and my doctor wants to order multiple tests, including a PSA for prostate cancer, a colonoscopy, and several others. But I've heard that some tests aren't necessary at my age and might even be harmful. Which tests should I question? What does the medical evidence really say about testing seniors over 70? This is the question that comes from confused seniors facing aggressive testing protocols, arrives in consultations from families watching their elderly loved ones undergo unnecessary procedures, and reflects the growing awareness that more medical intervention isn't always better, especially after 70. I want you to stay for this complete medical revelation, because by the end you'll have information that can protect you or your loved ones from unnecessary medical harm, while still maintaining appropriate health care. All right, let's start with the medical reality that few doctors communicate honestly. Medical testing after 70 requires a completely different risk-benefit analysis than testing younger adults. What might save lives at 50 can cause serious harm at 75. But the medical system often applies the same protocols, regardless of age and life expectancy. But as with all aspects of geriatric medicine, individualized assessment based on overall health, life expectancy, and quality of life priorities is absolutely crucial. One-size-fits-all testing protocols ignore the complex reality that aggressive medical intervention often reduces rather than improves outcomes in seniors over 70. So, let's start with the specific medical fundamentals. Which 5 tests are routinely over-ordered for seniors over 70? Why are they potentially harmful at this age? What does the medical evidence really say about their risks versus benefits? And most crucially, what questions should you ask your doctor before agreeing to these tests? Let's start with the testing realities that your doctor probably won't explain voluntarily. Medical test to question number 1: PSA screening for prostate cancer after age 75. This is the most commonly over-ordered test that causes massive harm in elderly men. The U.S. Preventive Services Task Force explicitly recommends against PSA screening for men over 70 because the harms outweigh any potential benefits. Here's why: prostate cancer in men over 70 is typically so slow-growing that you're far more likely to die with it than from it. But PSA screening leads to biopsies, which cause infections, bleeding, and pain. Then aggressive treatments, surgery, radiation that cause permanent incontinence, and erectile dysfunction, all to treat cancers that would never have caused problems during your remaining lifespan. A landmark study published in JAMA followed 76,000 men and found that PSA screening in men over 70 showed zero mortality benefit but caused significant harm through overdiagnosis and overtreatment. You're undergoing serious risks for no survival benefit. The question to ask your doctor, given my age and overall health: what's my actual life expectancy? Am I more likely to die with prostate cancer or from it? What are the specific harms of the biopsy and treatments you're recommending? Medical test to question number 2. Routine colonoscopy after age 75. Colonoscopy is extremely valuable for colon cancer screening in younger adults, but after 75, especially if you've had previous normal screenings, the risks often outweigh benefits. Colonoscopy in elderly patients carries significantly higher risks of perforation, hole in the colon, severe bleeding, and complications from anesthesia. The complication rate in patients over 75 is 3 to 4 times higher than in younger patients. Additionally, if polyps are found, the treatments carry even more risks. The American College of Physicians recommends against screening colonoscopy in adults over 75 with average risk who have had previous negative screenings. The likelihood of developing treatable colon cancer that will affect your lifespan is extremely low, while the procedure risks are significantly elevated. The question to ask, given that I've had normal colonoscopies before: what's my actual risk of developing colon cancer that would affect my lifespan? What are the specific complication risks at my age? Are there less invasive alternatives, like stool tests? Medical test to question number 3. Routine mammography screening after age 75. Similar to prostate cancer screening, breast cancer screening in very elderly women often leads to overdiagnosis and overtreatment of cancers that would never cause problems during remaining lifespan. A study in JAMA Internal Medicine found that mammography in women over 75 detected many cancers, but treating them didn't improve survival. Instead, it led to surgeries, radiation, and chemotherapy that significantly reduced quality of life without extending it. The harms include not just the anxiety of false positives, but the very real damage from treating slow-growing cancers that pose no threat. Breast cancer treatments in elderly women cause significant complications and may actually shorten rather than extend life. The question to ask: what's my realistic life expectancy, considering my overall health? If a slow-growing cancer is found, would treating it actually extend my life, or just reduce my quality of life? What does the evidence show for women my age? Medical test to question number 4. Aggressive diabetes screening and tight glucose control targets in frail elderly. While diabetes management is important, extremely tight glucose control, HbA1c under 7.0, in frail elderly patients causes more harm than benefit through dangerous hypoglycemia. Multiple studies have shown that aggressive glucose lowering in elderly patients increases mortality rather than decreasing it. The risks of severe hypoglycemia, confusion, falls, hospitalization outweigh any theoretical long-term benefits in patients with limited life expectancy. The American Diabetes Association now recommends relaxed glucose targets for elderly patients with limited life expectancy. HbA1c of 7.5–8.5 is appropriate for many seniors, yet doctors often aggressively treat to lower targets, causing dangerous complications. The question to ask, given my age and overall health: what glucose targets are appropriate for me specifically? What are the risks of hypoglycemia with tight control? Would a more relaxed target actually be safer? Medical test to question number 5, routine cancer screening with CT scans and extensive imaging. Many doctors order routine CT scans, PET scans, and other extensive imaging for elderly patients just to check for cancer. These tests expose patients to significant radiation and almost always find incidental findings that lead to further invasive testing. The problem is that many of these findings are clinically insignificant. They're abnormalities that would never cause problems during remaining lifespan. But once found, they trigger cascades of biopsies, surgeries, and treatments that cause real harm while providing no survival benefit. A study in JAMA Internal Medicine found that incidental findings from imaging in elderly patients led to complications from follow-up procedures in 23% of cases, with zero improvement in survival. The question to ask: what specific symptom or concern makes this scan necessary? What's the likelihood that any finding would actually change my treatment or extend my life? What's the risk of finding things that lead to harmful interventions? Let me give you a specific example of how these tests cause harm. A 78-year-old patient came to my office after his primary doctor ordered a routine PSA test despite his age. The PSA was slightly elevated, leading to a biopsy that caused a severe infection, requiring hospitalization. The biopsy found a slow-growing prostate cancer. His urologist recommended immediate surgery. When I evaluated him, I calculated that his life expectancy was approximately 8 to 10 years based on his overall health. The prostate cancer he had would take 15 to 20 years to cause any problems. If he had the surgery, he faced guaranteed incontinence and erectile dysfunction for his remaining years. If he did nothing, he would almost certainly die of something else before the cancer ever caused problems. He chose active surveillance, doing nothing except monitoring. 5 years later, he's 83, living fully, and the cancer hasn't progressed. Had he followed the original aggressive treatment recommendation, he would have spent his last years in diapers for no survival benefit. This story isn't unique. I've seen hundreds of elderly patients harmed by tests and treatments that never should have been ordered in the first place. The medical evidence is clear on appropriate testing after 70. Evidence point number 1. Most medical organizations now recommend against routine cancer screening in adults over 75 with limited life expectancy. The harms consistently outweigh benefits. Evidence point number 2. Testing should be individualized based on overall health and realistic life expectancy, not just chronological age. A healthy 75-year-old is very different from a frail 75-year-old. Evidence point number 3. The question isn't can we find disease, but rather will finding and treating this disease actually improve length or quality of life? For many conditions in elderly patients, the answer is no. Evidence point number 4. Patients have the right to refuse any test. Doctor's orders doesn't mean you must comply, especially when evidence shows the test may harm more than help. My urgent medical recommendation: before agreeing to any medical test after age 70, ask these 3 questions. Question number 1. What's my realistic life expectancy based on my overall health? If it's less than 10 years, most cancer screenings aren't appropriate. Question number 2. If this test finds something, what would the treatment involve, and what are its risks? If the treatment risks are high, the test may not be worth it. Question number 3. What does the medical evidence show about this test for people my age with my health status? Demand evidence, not just standard protocol. You have every right to be an informed patient who makes decisions based on your priorities, not just following medical protocol designed for younger, healthier populations. And before we close, I want to mention something crucial for seniors who are taking control of their healthcare decisions, but want to ensure they're supporting their overall health and vitality while avoiding unnecessary medical interventions. Making informed decisions about medical testing is essential, but can be complemented with natural support that maintains your health and energy without the risks of aggressive medical interventions. That's why I recommend two natural support options that help seniors maintain optimal health while avoiding unnecessary medical risks. For seniors who want gentle support for overall health and vitality while questioning unnecessary tests, I recommend organic watermelon extract, rich in natural L-citrulline. It supports circulation, cardiovascular health, and natural energy without the risks of aggressive medical interventions. But if you're looking for complete health optimization, not just avoiding harmful tests, but also maintaining energy, cognitive function, and vitality that keeps you healthy enough to avoid medical interventions altogether, then I recommend the Advanced Senior Vitality Formula. It combines Icarian from horny goatweed for circulation and energy, Tongkat Ali for natural hormone support and vitality, fenugreek for sustained energy and healthy aging, nettle root for prostate health without aggressive medical intervention, and concentrated L-citrulline for optimal cardiovascular function. Together, these ingredients support the health and vitality that allows you to maintain wellness naturally, reducing the need for aggressive medical testing and interventions. You'll find both options linked in the pinned comment and video description below. Take control of your healthcare decisions with knowledge and natural support, because quality of life after 70 depends on informed choices, not blind compliance with medical protocols that may cause more harm than good. Educational content for persistent symptoms.